Hi, I'm Honey Jacob, the nurse educator at IHNA Melbourne campus. Our campus is situated at the heart of Melbourne city. It is very close proximity to the public transport. Students can get here with trams, buses or metro, which make their transportation much easier. So this is our Melbourne campus entrance, which is at 131 Queen Street. On this building, we have the IHNA campus at the 5th and the 6th floor. Due to our COVID protocol, we have the check-in QR code scanning and also the hand sanitizer stations. So everyone who visits this building maintain the hand sanitization. Now I'll take you to the Melbourne campus and we'll go into the lift. As we step out of the lift, we have the emergency procedures. We have the stairs access to go to the downstairs if any emergency happens. And next we are going into the reception in the 5th floor. So as we go into the reception, we have again the QR code for COVID screening and also we go through this area. As we enter the 5th floor of IHNA campus, we have the hand sanitizing station which is situated next to the door. And then we have the students' information desk which gives the direction for the students where the classrooms, simulation labs, receptions, everything is situated. In this 5th floor, we have 3 classrooms which has the capacity for 30 students and 1 simulation lab, and also the computer lab, library, and also the students' dining and everything which we will take you through. Anyone who is entering the IHNA campus must be wearing a face mask as per the COVID protocol. As well as we have the students or visitors login details and also the temperature check just to confirm they are free from COVID symptoms. And then we have a hand sanitizer for everyone to access. This is our lab. So this is our simulation lab where the students will be able to practice and also do the procedures so that they will be well competent when they are up in the physical settings. This is our nursing lab in the 5th floor where the students come and practice their skills before they are being sent for the placements in the hospital settings. So in this lab we have 6 adult beds and 1 pediatric bed. Each adult beds are aged care beds in the 5th floor and we have ICU beds in the 6th floor which I'll show it later. So each adult bed we have a hand sanitizer for the hand hygiene to perform so the students can practice it well in the clinical settings as well. And each side of the bed we have an OPS machine where the students practice to take the vital signs like temperature, pulse, respiration and all. And also same like a hospital settings, we have the suction apparatus which is attached to the wall so that they can practice the suctioning, and also an emergency bell in case of emergencies how they have to perform in the hospitals. So these beds are well equipped so that they can practice the techniques before they go for the placements. We have mannequins on all our beds so that students can practice well. This is one of our full mannequin that's called SimMan. So which is a set which we can set in the computer the real readings as a person. So when the students practice they get the real values that we set on, and it has all the nursing procedures that a person has to perform when they go into the clinical sites. And also each bed has the IV pumps which is attached to them so that they can practice the medications, giving IV fluids and everything through this. And also we have the PCA pumps which the students can practice in the lab. Each station students are provided with a bedside table so that they can work on it, and also the students have the medication practice documentations and everything for each one so that they can practice same like a real scenarios. And also we have the sharp spin which is attached to the wall so that once they have practiced their or administered their medications they will be disposing all the sharps equipment in the sharp spin so that they don't have to hurt themselves, like they can get prevented from the needle stick injuries. Have another sharp spin and the infectious bin that are situated here and next to the hand hygiene area. This is our emergency trolley which is equipped with our ambu bag AD machines, and also we have the ECG machines. So the students can practice the emergency techniques if they have a first aid, like giving a CPR or anything. And we have the blood transfusion, which is also equipped with a hand, so that the students can withdraw the blood and really practice the blood transfusions. This is our storage area where we keep all the supplies which are needed extra for the students, and next to the storage area we have our medication room. So as we enter the medication we have for the students, we have all the needed equipments with a DD cupboard and the DD register for the students to do our S4 and S8 medications. We have a hand washing area as well. This is our shower room where the students practice their assisting the patients with their ADLs. So we have our lifting machines, then we have our commode chairs, and the shower is over there. And we have our toilets and hand hygiene areas here as well. So we do have a hand hygiene wash basin that is next to the lab, and we also have the waste management with the general waste and also the sharps containers and everything. So the students perform the 5 minutes of hand hygiene, which is very important for the infection control practices. These are also our storage space where we keep the interest articles. When they want to use that, they can use it. So we have all the equipments that are needed for the first semester, second semester and the third semesters, assisting with their ADLs and performing all the. This is our computer lab where the students have access to do their assessments or if they want to refer something. And we also have a printer. If the students want to get a hard copy of anything, they can get it from this. IHNA has an integrated library system. So we provide the students with online and offline services. So the online they can access from the student hub, and also the offline they can come to the library and they can refer the books. If they wanted to borrow the books so that they can refer it from home, they can. Otherwise they can sit here and refer the books and return it. We have our educators room where the educators sit during their working time. So this is our educators room, which is fully equipped with their laptops and the working folders and everything. We have a counseling room for the students. If they wanted to have a one-on-one sessions, they can come to the counseling room after an appointment. This is the campus manager's room. Now we are entering the student lounge area and the classroom. So in this floor, we have mainly 3 classrooms, out of which 2 are in this corner. So here we have the classrooms. The classroom number 2. Each classrooms are 30 students capacity, but as per the COVID protocols, we follow the minimum number of students, like 15 students at a time. We have the projector and the computer so that when we are taking the classes, the students can see on the projectors. This is one of our student lounge area where the students can have food, and also we have a microwave and the water supply here. And we also have an outdoor student lounge area. This is one of our outdoor student area where the students can come in a group and have discussed something or have their lunch. We have our student dining area where the students can have their lunch. So we have provided with microwave oven so they can heat up their food, and also a fridge where they can store their food so that it doesn't get spoiled. So we have all the supplies inside for the students. This is our staff area where the staffs can keep their food in the fridge and also heat up using the microwave ovens, and for a cup of tea or coffee they can come here. We have the restrooms here which are for females, and also one is there here for the males. Welcome to level 6 of IHNA campus. So now we have our reception towards the right side and the classrooms towards our left side. As we move on, we have a hand sanitizer station where the visitors and the students can perform the hand hygiene, and here we have the admin and the educators room, so where they are being seated. Seating area for the visitors to sit, and this is our reception where they can have access. So we do have an entry system due to the COVID situation. So anyone who visits IHNA campus will be entering the details in the folder. We also have the scan QR code check-in so that we can screen them for the COVID. This is our student support area. We have the student support officers where the students can get any help from. This is one of our counseling room. So we provide one-on-one support to the students who needs help. So this is like a private area, so they can share their things with the educators, whoever needs help. As we move along with the 6th floor, we have a fire hydrant and the hose which is situated next to the main entrance, and we have mainly 5 classrooms and 1 nursing lab at this level. This is one of our classroom. This is our second classroom in the 6th level. This is our 5th classroom. This is our student lounge area in the 6th floor where the students are having the food. On the corridors, we have multiple check-in QRs, so the students can access that and check in. We have the dirty utility room. We have the general waste bin, the infectious waste bin and the soiled one, and also we have the area to keep the pet pans, urinals and everything, and a sink so that they can perform the hand hygiene after disposing the. As we enter the nursing lab, we have the hand sanitizing station and the QR code check-in. So whoever enters the lab, they have to sign in here to track the COVID exposures. So next, behind the reception, we have the medication room, simulated one. So where we have segregated all the ampules, vials, syringes and everything for the students to practice. We have sample Webster packs where the students can familiarize with what it is before they go for their aged care placements. And also we have the DD cupboard so the students can practice in a real situations. And we have the DD register. So we also have the sharps bin after the preparation of medications to empty the waste and sharps, and also the Australian injectable drugs handbooks for the reference for the students when they are doing the IV antibiotics, which we practice in the hospitals as well. We have segregated all the products for practicing the nursing skills here in the nursing lab. We have like ID bandages, then we have IV practicing mannequins, NG tubes and IV fluids, sphygmomanometers, then thermometers for all the equipments that we need for checking vital signs. Then we have the wound suture and removal kits and all the equipments needed for that. So we are well equipped with all the articles that are needed, and we have a wound dressing trolley which the students can take to the patient side for each wound dressing for the patient. Next to it we have our shower room, so where the students are practicing the ADL. So we have provided with a curtain so that the students can practice, providing the privacy of the patients. We also have a lot of audio-visual aids that the students can use to learn the anatomical structure of the human body. So it's kept in the nursing lab, so whenever they enter, they can visualize it and learn about the human body parts. We also have a human skeleton to study the full anatomical structure of the human body. In this nursing lab, we are equipped with 5 ICU beds mainly. So each ICU beds have access to the suction apparatus, then the emergency call bells and the nurse's call bell. We also provide with bedside trolleys, same like how it is in a hospital settings, and also we have the IV pumps with an IV bags so that they can practice administering IV fluids and medication administrations through the IV cannulas. This is another SimMan mannequin, same like how we have seen in the 5th floor. So it is attached, connected to the computer, and we can program it so that the students will be doing the real skills in this mannequin. We also have the aids, that is the walking aids and the structures for them to practice assisting with mobility. And we have the emergency trolley here, which has the suction apparatus, that is a portable one, and also the ECG machines and the sharps container. We have the emergency items in the cupboard underneath, which are mainly used in the emergency situations. We have the blood transfusion sets and the sharps container, and also we have some NG tube feeding devices where we will connect it to the patients so that they can practice how we provide nasogastric feeding for the patients. Next to each beds we have the hand sanitizers so that they can perform the 5 moments of hand hygiene. We also have the manual handling techniques that we teach and the students learn in the lab. So we have a full hoist and also a standing hoist, which the students will be practicing to manual hand the patients. This is one of our another emergency trolley, and we do have 2 hand hygiene stations where the students will be performing the hand hygiene after each procedures, and also the waste disposals. So we have a small sharps container and also a cytotoxic bin where they will put the cytotoxic waste. We also have the catheterization, all the things needed for the students to practice the skills needed before they go for the placements. Next to the lift, we have our exit emergency door. So we have the staircase that is anyone can go down if there is an emergency, and also we have the fire alarm and the fire extinguisher if any emergency comes.